In this footage, we will examine 5 specific beverages that, if adopted immediately, may assist in ameliorating fatty liver conditions while diminishing exhaustion. These fluids do more than just bolster hepatic performance. They also aid in regulating glucose levels and decreasing deep belly fat. Every single suggestion here is grounded in scientific studies pertaining to hepatic steatosis and liver health. I work as an investigator in the fields of nutrition and metabolic wellness, having consulted with numerous individuals over the years. Now, let us commence with the initial beverage that you ought to incorporate into your routine, starting this very day. The primary liquid I wish for you to concentrate on is tea made from unoxidized green leaves. Consuming it consistently allows this tea to assist the organ in shedding accumulated lipids, slowly returning enzymatic markers to standard ranges and alleviating feelings of sluggishness. The underlying cause is that these leaves harbor a potent collection of oxidative inhibitors known as catechins, particularly one called EGCG. Within your system, unstable molecules known as free radicals are generated on a daily basis. You might visualize them as broken particles that can readily inflict harm upon your cellular structures, including those of the liver. When an excess of these unstable elements exists, the organ enters a state of oxidative strain, resulting in persistent inflammation. This beverage aids in clearing out a portion of these damaging agents, thereby lowering swelling within the hepatic region and the surrounding adipose tissue. Simultaneously, certain inquiries demonstrate that this tea might accelerate lipid metabolism and decrease accumulation in the abdomen and liver, potentially improving your measurements and weight eventually. For an individual dealing with hepatic steatosis, an uncomplicated method to begin is by sipping 1 or 2 mugs of weak tea daily. It is best to consume this during the morning hours or early afternoon, avoiding late intake to prevent sleeplessness and attempting to abstain from adding sweeteners. If you maintain this custom alongside nutritious dining, the drink will not only aid your liver, but also advantage your cardiovascular system, glucose levels, and mental focus. Nevertheless, depending solely on this tea is insufficient, particularly for those who struggle with glycemic issues and reduced sensitivity to insulin. At this juncture, a different fluid that may perform a highly beneficial auxiliary function is vinegar derived from fermented apple cider. This vinegar appears basic, yet when utilized properly, it can retard the rate at which dietary glucose enters circulation, lessening the insulin load and curbing further hepatic fat buildup. The process works because acetic acid, the primary element in vinegar, is able to suppress certain enzymes responsible for starch digestion, causing carbohydrates to decompose more gradually. This signifies that your glucose levels after eating do not surge too rapidly, allowing you to evade recurring spikes in sugar across the day. Whenever glucose levels do not ascend too drastically, your system is not required to secrete such a large volume of insulin. You must grasp that insulin is the chemical messenger pushing glucose into cells. Yet when these levels remain elevated for years, the body slowly grows desensitized to it. This condition is termed insulin resistance, and when it occurs, glucose cannot enter cells efficiently and is essentially transformed into lipids, which pile up in the liver and surround internal structures. By diminishing glucose spikes and the subsequent need for insulin, this vinegar obliquely assists in decreasing the volume of lipids being transported into hepatic storage. A few minor investigations have discovered that individuals who employ this vinegar appropriately see enhancements in glucose, blood fats, and even their total body mass. However, you are obligated to recall that this substance is not a pharmaceutical drug and must not be utilized to substitute your existing therapies independently. Regarding the method of consumption, you strictly should never ingest this vinegar without first watering it down considerably. A more secure approach is to blend roughly 1 or 2 tablespoons of the liquid with a substantial tumbler of water and consume it prior to major dining occasions. If your digestion can handle it, use a drinking tube or wash your mouth subsequently to safeguard dental surfaces, and consult a physician first if you are medicated for diabetes, have gastric issues, or are carrying or nursing a child. If executed accurately, This vinegar regimen can serve as a minor yet valuable component of your broader plan to regulate glucose and aid the fatty liver. Beyond the management of glucose, another significant element in hepatic steatosis is persistent inflammation alongside oxidative strain. It is in this specific area that tea infused with ginger emerges as a highly meritorious alternative to think about. Numerous individuals perceive this root merely as a warming condiment, yet in truth, it houses hundreds of active biological agents like gingerols and shogaols, which possess potent protective and soothing qualities. When the organ remains in a condition of prolonged swelling, the hepatic cells suffer progressive harm, creating a danger of advancing towards cirrhosis. This brew assists by fortifying the system's defensive mechanisms, aiding in the neutralization of surplus unstable molecules while simultaneously soothing the inflammatory reaction within the liver and adipose layers. Certain clinical trials have demonstrated that subjects who incorporate this root into their meals or utilize extracts may observe better outcomes in indicators like hepatic enzymes, glucose, and insulin sensitivity. A few cohorts even documented marginal decreases in body mass index and abdominal girth following a duration of consistent application. To state it plainly, this root aids the system in managing swelling and metabolic disruption more effectively, thus providing oblique support to the organ. You might employ several cuts of the fresh root soaked in boiling water, allowing it to rest for a few moments before sipping it as a tea. Provided you are not diabetic, you may introduce a small amount of honey or a squeeze of citrus to render it more palatable. This beverage supports the liver while also curbing queasiness, aiding digestive processes, and potentially offering slight advantages for arterial pressure and immune function. Having said that, if you suffer from gastric ailments, utilize anticoagulants, or possess any unique health status, you must converse with your physician regarding the appropriate dosage and timing. If you are a person requiring a more potent beverage to commence the morning, you might be astonished to learn that coffee, when consumed properly, boasts substantial data indicating it benefits the liver. Numerous extensive observational inquiries have revealed that individuals imbibing 2 or 3 mugs daily exhibit reduced incidences of steatosis, scarring, and certain hepatic malignancies versus non-drinkers. The precise biological pathway is not yet entirely comprehended, but we are aware that this bean is abundant in protective compounds and polyphenols that assist in lowering oxidative strain within the organ. Certain statistics also imply that the drink can affect hepatic enzymes and lipid processing routes, thereby aiding in the preservation of cellular integrity. The crucial factor lies in the manner of consumption. If you introduce abundant sweetener, thickened milk, or rich cream, the advantages are nearly obliterated by the surplus energy in glucose. A superior choice is plain black brew or a version with a moderate quantity of milk containing little sugar. The schedule is also significant, as you should evade consumption late in the day to prevent sleep disruption, since persistent lack of rest is another element aggravating metabolic issues. For individuals facing cardiac conditions, irregular heartbeats, nervousness, or caffeine intolerance, the intake must be personalized, and you should deliberate with your doctor on the safe quantity. This beverage is not a pharmaceutical detoxifier, yet when merged with a nutritious regimen and habits, it can represent a constructive segment of the puzzle for organ defense. Lastly, if you desire a botanical infusion that appears visually striking and can assist your liver, tension, and metabolic rate, tea made from hibiscus is an excellent selection. Dehydrated hibiscus blossoms produce a vivid crimson liquid with a tart flavor, abundant in flavonoids and polyphenol defenders that aid in shielding cells from radical-induced harm and lessening swelling. A few minor trials involving subjects who are heavy, obese, or possess metabolic syndrome indicate that utilizing extracts or sipping the tea consistently can ameliorate blood pressure, decrease lipids, and occasionally marginally lower hepatic fat. You may soak the dried blooms in boiling water for several moments, consuming it hot or allowing it to chill before adding ice if you favor a cold beverage. It is optimal to restrict or shun the addition of sweeteners, particularly if you struggle with glucose management. This crimson tea is appropriate for numerous individuals with hepatic steatosis alongside hypertension or dyslipidemia, yet it is not suited for every single person. Individuals with naturally low tension, those on potent antihypertensive drugs, and expectant or nursing mothers should consult their physician before routine use, as any botanical can possibly interfere with health status or prescriptions. When you review these 5 liquids, specifically green tea, cider vinegar, ginger brew, coffee, and hibiscus infusion, you will observe they possess a shared characteristic. They all function upon the fundamental processes linked to hepatic fat, such as oxidative strain, inflammation, insulin insensitivity, irregular lipid profiles, and arterial tension. Every single option boasts unique advantages, and not one of them constitutes a miraculous remedy. The important thing is not attempting to ingest all of them simultaneously, but selecting 1 or 2 that suit your palate, health status, and way of life, then maintaining them as a daily habit. When you pair these fluids with a menu low in sweets and processed carbs, increased greens, quality proteins, consistent exercise, and adequate rest, your physique will be in a far superior state to mend and recuperate, including aiding that overburdened organ. These 5 beverages represent merely a tiny fraction of the expedition to undo hepatic steatosis. For the organ to genuinely heal, you are still required to alter your dietary intake, your level of movement, and the quality of your nightly rest. I appreciate your viewership and wish you fortitude and steadfastness on your path to safeguarding your health.